Hi, Jen here. Today I'm going to go ahead and show you how to do a self monitoring blood pressure. So we have a little home unit here, and these are the units that we actually have given some of our patients that we're tracking for our Acorns grant, along with a journal to be able to monitor. Okay, so first we're going to go ahead and put our cuff on. We're going to slip our arm in there. We're going to pull this. Your cuff needs to be up above the bend of your elbow here. So make sure that's up. Okay? And then what we're going to do is take this, pull it over. We want this arrow here, it shows you. And you're going to want that to run our artery. Okay? We're going to relax. We're going to uncross our feet. We're going to rest our arm. And we're going to go ahead and push the on button. This should only take a couple minutes. Normally you wouldn't be talking while you're doing this. You don't want to be smoking or doing any exercises at all. You're going to want to do this in the morning as soon as you wake up. And then it's going to give you your results right on the screen. It's going to be a 138/80. So that's a good blood pressure. And then it also shows your pulse on here, which is 77, and we're going to talk about pulse rate in just a moment. Okay, I want to go ahead and read a little bit of blood pressure measurement instructions to you off of this sheet that I'm actually going to send out in our newsletter this month. And just as a reminder to help some people if they need a little bit, if they have some questions that they want answered. So don't smoke, exercise, drink caffeine or alcohol within 30 minutes of measuring your blood pressure. Okay, so rest in a chair for at least 5 minutes with your left arm resting comfortably on a flat surface. Just as a reminder, sometimes people, whatever, maybe they've had surgery or something, or there's some reason why they can't do their left arm, it's okay to do your right arm, either one. Okay. Make sure you're still relaxed. Sit in a still chair while your feet are flat on the floor with your back straight and supported. So we want to sit up tall. We want to have that cuff. We want our arm to be at level and at heart level. And then take at least 2 readings, 1 minute apart in the morning before taking medications and in the evening before dinner. And make sure you record all those results for your doctors. All right? Use properly calibrated instruments, validated instruments, and those are the ones that we have given to our patients, and those are mostly the ones that we're getting from the store or wherever it is that you got it from. And then, as a reminder, place the bottom of the cuff above the bend of the elbow. So you want that cuff up here. And it's also important to make sure the cuff is a good size too. You don't, it needs to be big enough, to be able to slip it on your arm and then go ahead and pull it over. So if you have any questions, you can ask your physician though. I'm sure that they can help you with that. So, and these are American Heart Association guidelines on our little paper we have here. All right, so good luck. I'm going to include this chart so you can see on here what would be normal, elevated, high blood pressure, hypertension stage 1, stage 2, and then hypertensive crisis, which would be obviously to consult your doctor immediately if any of these, these numbers above, and make sure you check. So, and you're going to take this blood pressure in the morning before you take your medication so we can kind of see what's happening. All right, so again, these will be enclosed in our newsletter that we send out, or it'll be on this video for you to recap at the end if you'd like to. So we're going to move on to the pulse ox, and Crystal is going to demonstrate on how the pulse ox is going to work.
Hi guys, it's Crystal here. So I'll be demonstrating pulse ox for you guys. So we'll be giving you guys these little machines, and these are called the pulse ox, and it has your pulse ox, which is what your oxygen level is, and it has your heart rate on it also. So there's going to be 2 different numbers on there, and then I'll go through the differences between the 2 numbers. So you'll turn it on by pressing this little button right here, and then you'll put your finger in. And sometimes if your fingers are cold, it doesn't read, so you want to warm up your fingers before you put your finger in your on the pulse ox. So you just let it sit there. So my oxygen stat is at 99% and my heart rate is at 82. beats per minute. And you can see those numbers right here. So the percentages on top is what your oxygen level is at, and then this little smaller number is what your heart rate is at. And then I believe Jen also said your heart rate's on our blood pressure cup.
All right, I have a few fun facts for you guys. All right, so blood pressure versus heart rate. Your heart rate is separate from your blood pressure. That's the force of your blood against the walls of your blood vessels. A faster pulse doesn't necessarily mean higher blood pressure. When your heart speeds up, like when you exercise, your blood vessels should expand to let more blood pass through. And what is a normal heart rate? A normal resting heart rate is usually between 60 and 100 beats per minute. Your number may vary. Children tend to have a higher resting heart rate than adults, and the best time to measure your resting heart rate is just after you wake up in the morning and before you start moving around and having any caffeine. How does a pulse oximetry work? A small electronic device called a pulse ox is clipped onto a part of the body, usually the fingertip, and the device emits light that passes through the fingernail, skin, and tissue and blood. On the other side of the finger, a sensor detects and measures the amount of light that passes through the finger without getting absorbed by the tissue and the blood. So using that measurement, the device calculates the oxygen saturation of the blood. We hope that you like our video, and we hope it helps with you monitoring and journaling your blood pressure. Have a good day.